Okay, so I'm here with Houman Farzin. Would you like to introduce yourself for our members of NPV?
Hi, yeah, I'm a palliative care physician based in Montreal, and I've started doing some of the first psilocybin assisted therapy for patients with end of life illness.
So Houman is treating patients in the end of the life, cancer patients. And would you like to share something with us that you cannot necessarily communicate through the scientific reports? Something about your personal experiences of working in palliative care?
Well, I mean, with the science, we try to represent things as accurately as possible. Would you like me to hold it, or you're going to keep?
Oh, you can hold it.
Yeah, whatever you like. But that's a good question. I mean, ultimately, the question is, how can you gauge the suffering, and how can you affect and reduce the suffering? And so we're constantly coming up with new tools to be able to understand, how patients are feeling, and essentially defining the nature of suffering that goes with a life-threatening illness, whether you're actually dying or not. Because many people are not going to die, but just by going through the treatment alone, they get traumatized. And so, where we're reaching is this viewpoint of trauma, so a post-traumatic stress related to the illness. Now, in some contexts, it could be at the end of life, but in others, it could be just going through the treatment with even the possibility of full remission of your cancer. And so, it's about finding that nuance and being able to define it, objectify it, and so to be able to demonstrate with the research how much your intervention is making a difference.
Thank you. So what is something that you would like to communicate to practitioners treating cancer, but that are not necessarily directly involved in any therapeutic work surrounding the psychological circumstances?
Thanks. Yeah, that's a great question. And that question is really important for me personally, because the first patient in Quebec who got the permission to use psilocybin because of her cancer diagnosis actually didn't get to complete that psilocybin treatment because of the oncologist involved in her care, who threatened to stop her care if she takes the psilocybin. And so, it's important for practitioners to be aware of the stigma that exists in society and to educate themselves on modern studies that are demonstrating safety, efficacy, and endurability of the positive effects of psilocybin in this patient population, and to understand that psilocybin is one of the least toxic compounds available, and work together to have a patient-centered approach and respect the experience of the patient going through the treatment, such that it's not just about saving the life, but the quality of life is also important.
What are some potential pitfalls for future therapists who are dealing with this type of end-of-life anxiety? And what have you learned during your experiences that may be useful to communicate for people entering the field or who will be entering the field soon?
Yeah, I mean, the reality is psychedelics give us access to content in our subconscious that we're not normally exposed to. And if someone's coming from a very difficult place, that may bring up difficult content. And it's a very delicate art on behalf of the therapist to be able to handle difficult content. I think that's one important aspect. And the other important aspect is, with psychedelic therapy, there is a huge power differential. And as we've seen in recent cases that have come out from other trials, the therapists really need to work on themselves from a psychotherapeutic perspective and make sure that they don't fall for their own weaknesses in this power dynamic where they have an extremely superior power on a patient that's in an altered state of consciousness. So I think that's really important. And the other aspect is, we try to facilitate a beautiful experience and a mystical experience, but the reality is that when someone is suffering significantly from physical ailments, for example, this last patient I treated who has a chest tube and is in constant pain, has difficulty breathing, and essentially is dying. The beautiful mystical experience of psilocybin is helping him at some level, but it didn't reduce his suffering. And so we have to be ready for experiences that are beautiful but not necessarily going to change people's lives when they're actually dealing with the reality of the fact, which is that their body is shutting down due to illness.